How much? Let's explore how much it costs to have multiple chronic illnesses. Now let's take a breath and get into it. Welcome to Slow Roll. My name is Stephanie, this is Emilio, and I'm a Canadian with disabilities. On this channel, we talk about the fun topics that are disability, money, the day-to-day. Now let's get into why you clicked on this video, which is how much do we spend on my chronic illnesses? I want to start by saying that the purpose of this video is not to compare or complain about anything, but to bring general understanding of the costs associated to illness, the impact of the insurance companies here in Canada, and the healthcare system as a whole, or in general. Let's get into the actual numbers. Now, I've broken this down in a few different ways and we'll get into a few little details, but the general concept is I've broken it down to monthly expenses and yearly expenses with a couple of caveats. Let's get through the list. Stick till the end of the video if you really want to know how much we spend out of our pocket versus how much insurance pays. We've rounded each number to the closest dollar only for simplicity. And we have rounded a few other numbers as certain expenses do vary month to month, but we wanted to make it as clean as possible and as simple to understand. So we averaged a yearly expense. We took all my expenses from 2021 and averaged them over a monthly amount, just to make things easy. Okay, let's get into this. The actual breakdown of everything. I spend $525 a month on my gym physio plan. So I've got a trainer who is certified in physiotherapy, who supports me and trains me twice a week to work on function and primarily different motions so that I can maintain strength, because I do spend about 18 hours or so a day in bed or in a laying position due to my chronic illnesses. And so this really gives me that moment to really focus on rebuilding strength and focusing on making sure that I'm doing everything I possibly can. I also have home exercises that I do on a daily basis. So all those things work together to kind of support my health. So that's $525 a month. Now, for me to be able to have access to my trainer, I have to pay an additional $50 a month for the gym membership, which I don't really use because I only have the capabilities of going twice a week right now to go and meet with my trainer. I used to be able to do a little bit more than that, but unfortunately life is just not that reality right now. And so that's just kind of a sunk cost associated to me having access to my trainer. Next up, due to the fact that I don't drive anymore or simply can't drive anymore, it's cost me $320 a month on average to get to medical appointments, to get to my gym trainings and things like that. Now, we do have family and friends who help us out here and there when they can, which is a great help because it's about $40 or so a trip there and back for me to go just about to any of my appointments. So every time we have someone bringing me back and forth, it saves us quite a bit of money, which we truly appreciate. But on average, we spend about $320 in transportation for me to get to where I need to go. And that's just for my appointments that aren't covered. That doesn't include everything. Next up, we've got meds. So I've got a couple different category medications, but my daily medications that I have to take, I spend roughly $110 a month. Now, meds, dosage, all of that changes kind of a lot because my illnesses aren't fully diagnosed, one, and two, we haven't quite gotten me to a stable point, but that's roughly what it was for last year, and I don't think we're going to be changing much this year, so that's pretty much what we're looking at there. So the grand total for my monthly expenses is $1,005. Now, we're going to multiply that by 12 so that we can get a lovely round number for the yearly expenses. And so my monthly expenses cost us $12,060 a year. Now let's get into the really big numbers, which are the yearly expenses, which can get pretty out of hand sometimes. Yearly expenses. We've got a couple that are budgeted. We budget about $5,000 a year to spend on a specific thing that I'm gonna need. So last year we bought my electric wheelchair, which was a huge shift in my care. I love that thing to death, and we can't wait to release the review video for that. So stay tuned for that. And if you aren't subscribed yet, perfect time to subscribe so you don't miss out on that video. This year, we have a specific project in mind. I'm not gonna reveal it just yet. It is coming in a couple weeks, and we are so excited. It's going to, again, have a huge effect on my day-to-day. And so we've budgeted about $5,000. We've been saving all year for this. So we do this every year. Maybe one year we won't have to do this, so we'll be able to save that $5,000 for a trip. But hey, we got to get the day-to-day fixed up first. So that $5,000 is pretty much just accumulated month to month until we have to spend it on whatever and it ends up being that year. And then we have my infusions. So my infusions are for my Crohn's disorder. They are the most expensive of my medications, which is why we've subdivided them into their own little category. I get infusions every 6 weeks, which is, pretty standard. Everyone has different infusion schedules, but for my medication and my dosage, we are looking at infusions every 6 weeks. The total is $12,500. Now, that's not all the costs associated to my infusions. That's just what we have to pay in deductibles to hit the minimum with our income for the healthcare system to kick in. So we pay $12,500, and then the actual cost of all of my infusions on a yearly basis is actually just over $50,000. And this is where I'm going to take a quick pause from the numbers and get into the impact of our healthcare system. None of these numbers even close to discuss the monthly appointments I have with my medical doctor, the costs associated to that if we weren't in a free healthcare system, the cost of me going and getting my colonoscopies done, the costs of me getting all these different things done within the medical system, my neurology appointments, my gastro appointments, all of the different specialists I have to see. I have actually no idea how much they cost. From a medical perspective, I don't know how much someone would generally pay for these things. Let's not even get into, the amount of days I spent in hospital beds and all that. These past few years, I haven't had to be taken to hospital via ambulance. That's been a savings, which is kind of a weird statement, but it's the reality. Most years, we typically have one, if not two ambulance rides for me, which can cost up to $500 a shot. The impact of the provincial and federal governments and their subsidies associated to our healthcare system and the fact that we have a free healthcare system is huge. Now, is it perfect? No, we're not going to get into that today, but I just want to explain that these are just the numbers that are covered by us, not the entire picture of what this could look like if we didn't live in Canada. So I do feel blessed to be a Canadian, and I do feel truly honored to have this system we have. Perfect or not, there's a lot of really good things about our system, and to be frank, we'd be bankrupt without it. So now back into the numbers so we can get through the rest of them. Next up, we've got my massages, which I do want to caveat this. Massages and CHIRO I used to do prior to being chronically ill. The only difference is that the spend that I have now for both of those have exponentially been higher the last few years. There's probably no change in that anytime soon. I need this chronic care due to my chronic illness, and so these things are going to continue, and rising inflation, they're just going to keep getting more expensive, which is glorious. But for massage care, last year I spent $664. CHIRO cost $820. Acupuncture was $300. Doctor reporting so that I could keep my disability payments was $120. And my CPAP supplies, because I do have sleep apnea now, thanks chronic illnesses, is $250 a year. Now that does not include a machine or anything of the big expenditures. It's about $2,000 to get your system installed, to get your machine, all your filters, your hoses, all of that. But on my yearly supplies are $250. Now, a machine will usually, last about 10 years. I just got my machine last year, so we've got a ways to go before we have to look at another big spend. But year over year, it is something to consider. And the year that I will have to replace my machine, that $5,000 budgeted, one of those, part of that amount is going to be going to a new machine eventually one year. So that is all the lovely numbers. Now, let's get into the totals. The grand total for everything is $31,714. Now, if you've made it to this part of the video, you're probably asking yourself how much of that is actually covered by us and how much is covered by our private insurance. Before I answer that, I just want to say that people underestimate the impact of private insurance. Yes, it's expensive. Yes, it sucks to have to pay, but you just never know when something could happen, and the impact of private insurance on our care, i.e. my disability payments, i.e. the income that helps pay for this house. I wouldn't have had that if it wasn't for my employer and if it wasn't for the incredibly awesome plan that they had for us. I'm very, very grateful for that because I'm very lucky to have the plan that I do. And so I just want to put that in there because it has truly had a huge impact on, our day-to-day lives. I am also lucky that I am double insured with Luke's insurance, so we do have a lot of it covered. But I am lucky, and I know that I am, something that we may not have forever. My access to private insurance may change over time just simply due to certain factors. We're not looking forward to that day because these numbers are going to change very drastically if that has to ever happen. Private insurance has paid $17,874 out of the $31,000 and change. And we personally pay $13,840 out of that remaining amount. It's a good portion of, my disability benefits that I get. The reality is my disability benefits don't go up with inflation. The number that I receive, I will be receiving as long as I'm disabled. That number won't change. We're planning for that, and that's something that we need to consider because things are just continuing to go up. And my payments aren't going to change. Life can get kind of complicated that way. Honestly, the biggest part of all of this has been learning to cash flow these expenses because as much as insurance covers that $17,000, it takes time to get that money back. You gotta be on top of it. You gotta make sure that your paperwork's done and that everything's flowing in and out properly. And so we have to cash flow a lot of money. I spend a lot of time administering all of these things. Those are the numbers. Just over $30,000 spent last year on my chronic illnesses. I'd love to know your thoughts on how you think this is. Do you spend more? Do you spend less? I'm just curious to know how things go for you and how the system could potentially be different or could help you in some way. There's a lot of talk about potentially having a pharmacare system that helps support or better support medical expenses and things like that. And so I'm looking forward to what the future will bring for Canadians and what could be for our future as people with disabilities. But until then, leave your comments down below, like this video if you guys want more budget and financial numbers and more breakdowns. And till next time, don't forget to slow your roll.